Ned, specifically on the aging population, the baby boomers, you're getting more and more people getting to that level. What are some of the specific things that you have in mind to help that situation?
You're right. As I said before, we're going to have about 40% more people over the age of 65 in the next 10 or 15 years, and we're going to have fewer people in working age population. So we're going to keep faith with the folks who have to be in a nursing home, who really don't have an alternative. Make sure that we don't play games in terms of reimbursement. They're taken care of. But fundamentally, we're going to reform, how we treat our elderly. Make sure that more community-based alternatives, home health care alternatives, ways that our parents and grandparents have an opportunity to stay at home longer. I think our parents would like that opportunity as long as they feel comfortable there. And by the way, it would save the taxpayers of Connecticut potentially hundreds of millions of dollars.
Healthy lifestyles are great, and salads in schools are good, but here in New Britain we're losing teachers, we're losing health professionals in our schools. Our counselors are 700 students to one counselor. So salads are great, but what are we going to be doing to bring back school nurses, counselors, and mental health people that can help the kids who are in trouble?
Well, just remember, it's the high cost of healthcare which is eating up about 40% of our budget right now. So we can slowly bring down those costs and provide better service. That does free up more money for education. That does free up more money to invest in our future and invest in our young people. You're right. I was here, as you remember, just a few days ago, and I know that New Britain has the potential to be laying off over 100 teachers. What does that say about the future of our state? Our future is the quality of our workforce, the best educated workers in the world, and that starts with our young people, kids right here in the New Britain school system. We're going to do everything we can to keep faith with them. Terry, do you want to add to that?
Said, John, one thing, Jim, one of the parts of Ned's plan that was also Speaker Chris Donovan's proposal was to create pooling. We take all the municipal employees and put them in the same pool as the state healthcare state employees. We'd save somewhere between $100 million and $200 million just by doing nothing. Their benefits wouldn't change, but the city of New Britain, for instance, would save about $1 million. And that would be one way of helping to get back those teachers and other counselors that are needed, and not change the benefits for the employees and not change a thing, but just create efficiencies by buying in bulk, like we all do in our own ones.
And I think just one additional difference between our plan and the other plans out there is that there's a real emphasis on prevention. And that we haven't seen that in the state, where you're really focusing on the full person and early intervention of mental health, other ways to save money on the back end. So we don't have folks who have to be in a nursing home who don't want to be in a nursing home. Okay.
Thanks,
so
everybody. Appreciate you being here.